Welcome to Module 4, Session 2, Ethical Considerations in Research on Female Genital Mutilation. The learning objectives of this session are to learn how to address ethical considerations in different types of research on FGM, to list and learn to explain the core principles from the ethical conduct of research involving human subjects, to know and understand key concepts in research ethics and their applications at each stage in the research process, from the study design stage to the study implementation stage, through to the data analysis and dissemination stage. When we talk about evidence-based decision-making in public health or medicine, the basis of this decision-making is strong evidence that comes from strong research. Research must have scientific and social value. So if you're asking people to participate in research, that research must not only be scientifically well designed, but must also contribute to some greater goals. This is essential in all research involving human subjects. Research processes must make sure that they respect the rights of the participants. And as a sensitive topic, FGM research requires careful consideration of how to apply the ethical principles that relate to all research on human subjects. Research on FGM involves inquiry on a highly sensitive and traumatic practice. Until recently, research on FGM had been conducted with no specific ethical guidance available as a resource for researchers. There is a need for high-quality ethical research on FGM to inform the international community and national and local stakeholders who are working to end FGM. It's also important for investors, policymakers, and programmers to have well-conducted research and evidence to be able to make evidence-based choices to maximize the impact of interventions while ensuring the rights of participants are respected. In 2022, WHO launched this new resource. It's called Ethical Considerations in Research on Female Genital Mutilation. The document is structured around 3 stages of research: the study design, study implementation, data analysis, and dissemination. It includes 6 hypothetical scenarios for those who are using this resource to work through as they're grappling with certain questions around conducting research that involves FGM. There are some checklists on each of the stages of research to make sure that the ethical principles are applied throughout the research process. The intended audience is, of course, researchers who are planning and conducting research, but it's also relevant for research ethics committees who are reviewing protocols and who are making choices about research protocols and if they should be approved. It's also useful for end users of research results to understand if research has been conducted in an ethical way, to make sure, again, for the evidence-based decision-making, that the research that's informed that evidence has been done in an ethical and safe way. Research on FGM can take place in a variety of settings, and most of the research that's been conducted to date has taken place either in health facilities, in community settings, in schools, and in other places. There are a range of study designs and study methodologies that can be applied in research on FGM, and these really depend on the research questions, which would be the most appropriate research designs and which would be the most relevant types of settings to conduct the research. In general, we can categorize the research on FGM as falling into 4 different categories. There are descriptive studies, there are observational studies of associations or correlations, there are experimental and quasi-experimental studies that may be testing different approaches or programs or policies or interventions. And then there's implementation research. So different study designs bring up different ethical challenges, and we'll go through some of these in the subsequent slides. So descriptive studies can contribute to the overall knowledge of FGM by documenting the prevalence of the practice, the drivers of the practice. They can increase understanding of the different characteristics of the types of FGM, about different beliefs that drive the practice, about power structures, and how the practice may differ in different communities. Population-based studies, for example, can be very important in tracking progress of indicators for global monitoring efforts. For example, the Sustainable Development Goals, there's a target on FGM under 5.3. Some examples of data sources of descriptive studies include population-based household surveys like the demographic and health surveys that may have a module on FGM, or the multiple indicator cluster surveys, or any other number of surveys that may be administered in different places, whether at the household level or at the facility level or elsewhere. Ethnographic or anthropological investigations are also a form of descriptive studies. They document and describe a situation in a particular setting and can help to explore some of, again, these beliefs and power structures and decision-making around FGM. There can also be rapid assessment processes, and these could use a mix of quantitative or qualitative methods, and these can give an overview of different aspects of FGM in a specific setting as well. And there may be case studies from a particular country documenting about laws, about policies, and about different epidemiological considerations in different settings as well. So this is a brief summary of some of the ways that descriptive studies can be used and some of the data sources of descriptive studies. So when we talk about observational studies of associations or correlations, in these studies we can use any number of different data sources, but what we're doing is observing differences between groups, trying to either identify risk factors or variables that may be associated with the likelihood of undergoing FGM, for example. These could be cross-sectional studies, or they could be longitudinal studies. They may be retrospective or they may be prospective. But the point is that these are studies that are trying to relate two different variables to each other. What are the risk factors? What are the outcomes of FGM, for example? Data can be collected at the household level, again, at facility level, in schools or other community settings. It can be questionnaires or surveys. And we could also use existing medical records or population-based surveys again. There are many different ways that observational studies can inform the knowledge base around FGM, and some of these have been with health outcomes or with risk factors, for example. When we talk about experimental and quasi-experimental intervention research, this is research that is trying to understand what works, whether it's to prevent FGM or to improve care or child protection. So if we're talking about primary prevention interventions, these are interventions that are doing primary prevention of FGM in high-risk communities, so for preventing the practice from happening in the first place. Secondary prevention interventions relate to those that try to prevent FGM from reoccurring. So this may be among women who have undergone type 3 FGM and who have been deinfibulated to prevent them from being reinfibulated, for example. And then there's tertiary prevention interventions. So these involve making sure that women who have experienced FGM receive the treatment and care that they need to mitigate any physical or psychological or sexual health complications of FGM, and to actively encourage health-seeking behavior and making sure that they engage with and take up services within the health system or through other service provision. These can prevent any morbidity from FGM. Implementation research is a scientific approach to understanding why and how the implementation of a particular program or a policy or an intervention can result in the desired outcomes in a real-world setting. So that's key in implementation research, is that you're testing something in a real-world setting. Now, you can use a number of different methods for implementation research. These can be qualitative or quantitative, but it really depends on what your research questions are. When we talk about implementation research, we're often talking about scaling up an intervention that we've shown to be effective or efficacious in a particular setting, and we want to see if it works in another setting. We want to see if it works when brought to scale. We want to understand some of the barriers or facilitators for it to work and the conditions in which we can get the best results. This would thereby increase the effectiveness and the impact when we subsequently implement it. When implementation research studies are conducted appropriately and ethically, the findings of this type of research can really improve programs and policies, because we can really understand how to bring effective interventions to scale and ensure that we can implement them in an equitable way and to reach the population groups that are particularly affected by the practice. There are some specific ethical considerations related to implementation research. So as I mentioned, implementation research is doing research in a real-world setting. So who is consenting and how aware are they of any changes that may be taking place? For example, are the clients or patients aware, or have they consented to testing some new approach in the place they are seeking services? Are the healthcare providers in those settings or other members of the health workforce fully informed of the research? And are the community members who are seeking services or who may be impacted by implementation research aware and informed, and have they given consent? So these are really important aspects that must be taken into consideration in the development of the protocol. Some examples of implementation research are scaling up of a training of midwives to counsel mothers on the impact of FGM and on why they should prevent the practice. So this may be a scale-up based on positive outcomes from a pilot study. Another example could be taking a peer mentor program that has been tested previously and shown to be effective, and to implement this in a range of different settings. Research with human subjects must be done ethically, and there are a number of documents and principles that underlie this research. There's a long history. I won't go into all of this now, but it's really based in the principles of medicine, of do no harm. So some of these ethical principles in medicine have then been also applied in research, and making sure that any research that's done is done for a greater good and that nobody is harmed in the process. So the Council for International Organizations of Medical Sciences, CIOMS, was founded in 1949, and they developed research ethics guidance. And this is based on a number of other already existing materials that I won't go into right now. But then these were subsequently revised in 1993, 2002, 2009, and 2016. So the 2016 CIOMS guidelines reflects a number of advances in this research. So it's really trying to respond to issues that are more current and that come up as the thinking evolves on research in public health and medicine. So for example, the importance of translational research, making sure that research that's conducted in low resource settings is fair and ethical and equitable, that there's community engagement in the research, and the importance of including potentially vulnerable groups. So there may be special protections that need to be put in place, but it's important that research that's done to inform all populations really involves everyone who could be involved. And so excluding people from research can also exclude them from ultimately receiving the interventions that the research may be testing. So the concepts that are outlined in this CIOMS document form the basis for the document that I showed on the previous slide, this WHO ethical guidance document on research on FGM. So you can see some more information about this document in the references. So when we talk about ethical principles in research, it's really important to consider that how research is conducted has implications for the rights and the welfare of the participants, as well as for the quality and the validity of the results. And that has implications for how we ultimately can apply the findings of the research to inform programs and policies. So some of the core principles for the ethical conduct of research involving human subjects include the respect for persons, beneficence, and justice. And these principles place ethical obligations on researchers and on research ethical committees, research ethics committees, and we'll explain this more in the subsequent slide. So I'll talk a little bit about these three principles in ethical research. So the first one is the respect for persons, and this relates to informed consent in particular, and that anyone who participates in research should have informed consent. We should make sure that they're fully informed, they have the information that they need, that they understand the nature of the research, that's the objectives of the research, how to get more information, what happens if there are any unexpected events, and make sure that they're participating voluntarily. We need to distinguish between people with and without autonomy to make decisions and make sure that we protect their interests as well. And there should be a focus on how those with a diminished autonomy are treated in the research. For example, children, people without the mental capacity to consent, and we need to put in place different protections to make sure that their interests are protected and their rights are respected. Beneficence relates to the idea of doing no harm and maximizing the possible benefits of the research while minimizing the possible harms. So beneficence is the process of assessing risks and benefits and making sure those are taken into consideration in the research initiative. Justice relates to the fairness in the selection of participants and how the research findings are also applied. And research subjects should not be included just because they're easy to access or because they're vulnerable, but it must take into consideration how their rights are going to be respected and making sure that there's no discrimination in the selection of participants and that the findings of the research could then be applied to all these different groups. The learning from the research should not benefit some groups more than others because of their status. So the document that I showed you previously, the ethical considerations in research on FGM, was influenced by other documents that had been developed by WHO previously on other sensitive topics, including on research on violence against women and on adolescent sexual and reproductive health. One of the key ethical principles is privacy. It is a fundamental element of ethical research, and it needs to be respected to ensure that the rights of the research participants are respected. So researchers must ensure that participants are in control of the type of information that they share, how much information they share about themselves through the research process, and that personal information, when collected, is stored in a way that ensures that their privacy is respected. In communities where FGM is practiced, questions on identity and power and about their voice are very much linked to their FGM status and as their status as girls and women in that society. And the nature of the information that's shared during research is often highly personal and linked to their own personhood. Through the data collection process, we should ensure that the research participants have trust in the people interviewing them and that they do not ever feel coerced to disclose a greater depth of information than they are comfortable with. Vulnerability is a risk in research, so women and girls participating in research on FGM are potentially vulnerable to a range of psychosocial or physical harms. Participating in the research can have immediate or long-term implications for them and their families if the information is somehow revealed. And harms that can come from the research can be either unintended harms, or it could be secondary trauma from retelling of traumatic events, or could relate to sanctions for not conforming to social norms associated with the practice where the prevalence of FGM is high. There may be contextual factors that play a significant role in determining the different forms of vulnerability of individuals and groups, and these must be considered. And appropriate protection should be put in place so that persons who can be vulnerable to harm are treated ethically and fairly throughout the research process, and to ensure that they have access to participation, but they also have access to the protections and to harms that could come from participating. There are different layers of vulnerability, and with each additional layer that can add to the individuals' degree of vulnerability, and this should be acknowledged and addressed throughout the research process as well. Procedures can be put in place to protect privacy, to maintain confidentiality, and these can help to mitigate any vulnerabilities that can arise, but we cannot eliminate them completely. Therefore, appropriate support services should be put in place, or referrals should be put in place during the research, and if possible, these should continue after the research is concluded, and the research participants, as well as any control groups that may be involved in the study design, should all have access to this. Even the researchers themselves may need access to some kind of referrals or extra support services because of secondary trauma of listening to stories. It's important to say that vulnerable groups and individuals should not be excluded from the research because their perspectives can really help inform the findings. The purpose of managing confidentiality throughout the research process is to reduce the risk of harms to participants by their disclosure of any sensitive information or data, and to prevent any findings from being attributed to particular research participants. So sensitive data on FGM research can include personal information about participants, about their personal experiences, about their beliefs, or about any behaviors. All of this information should be kept confidential throughout the research process. So it is the responsibility of members of the research team to establish the overall framework for maintaining confidentiality through the research process. So they should make sure that there are appropriate procedures and protocols in place to ensure that data are anonymized, that they're stored securely, and that there's no way to identify individuals participating in the research. Research team members should be trained, and they should be provided with resources and mechanisms to make sure that they can adhere to the protocols on confidentiality. So it's not just having the protocols in place, but having support in place to adhere to these protocols. Community leaders, community mobilizers, and other key members of host communities should be aware of the protocols on privacy and confidentiality. And research participants, particularly in focus group discussions, should be made aware of their responsibility in maintaining confidentiality of any information that's shared by other research participants. And confidentiality should be maintained through the dissemination phase as well. So there should not be any disclosure or identifying information that can link individuals in the presentation of the study results and findings. So as mentioned already, there are ethical principles that need to be applied at all stages of the research. In the study design stage, some of the following areas are important to consider in designing the study. The research should be justified, so it's not ethical to conduct research on topics that do not have a scientific justification. In the ethical guidance document, you can find a hypothetical scenario. I'll show it in the next slide. It's also important to consider the legal status of FGM in a particular setting. It's important to understand how the language around FGM is used in a particular setting and not have ambiguity in language, and also to respect how local communities refer to practices and to other concepts. The engagement of communities from the outset is an important aspect of ethical research. There should also be capacity strengthening initiatives integrated into the research process to make sure that those who are involved in the research own the research and become better able to conduct research in the future. And again, it's important that there are appropriate informed consent procedures that are built into the research process. For each of the stages of research, we've come up with 2 hypothetical scenarios to help researchers to work through. And these 2 are related to the study design stage, and one relates to the justification of the research, and the other one relates to the use of language around FGM and how the questions are asked in a questionnaire. So I invite you to go through these on your own. So we've developed checklists for each of the stages of the research, and for the study design stage, for example, There are a number of considerations, some around the positioning of the study in the wider research context, around engagement with the community, understanding the local context, and engaging local stakeholders, the importance of this, about minimizing risks to research participants, understanding what those risks might be and trying to make sure there are measures in place to minimize the risks, making sure there are support and referral mechanisms, as mentioned previously, that the information around FGM is accurate, and that we have systems in place at all stages to monitor risks and to respond to them if needed. In terms of the methodology of the research when designing a study, the methodology should take into account different cultural sensitivities in relation to FGM. There should be core values around justice, around balancing benefits and harms. The sample strategy should take into consideration some of the aspects of justice as well. Informed consent should be given by the participants, and the researchers must make sure there's adequate information available and that the participants understand. Sensitive and standardized processes should be put in place to protect privacy. Systems and protocols should be in place to manage confidentiality. Research tools and techniques should be developed collaboratively with local stakeholders. The dissemination process, both at the local level, the international level, and at the national level, should be included from the research design stage. And regardless of whether FGM is a primary or secondary aspect of the research, there has to be adequate training and capacity building of researchers around the topic to make sure that they ask questions sensitively and that any support is provided that may be needed. The selection and the training of the research team members is also critical. The selection of the researchers and the data collectors should make sure that they have adequate skills, that they understand how to ask questions sensitively. They should not have conflicts of interest, and if they do, those should be declared and managed. The training that should be done for the data collectors should really emphasize the sensitive nature of research on FGM. If women and girls are going to be asked about FGM and their beliefs about FGM and their experiences about FGM, that should be done by female data collectors. There are a range of potential risks to data collectors and the research team members also, because they're asking about a topic that's sensitive and sometimes contentious in particular communities. So there should be an identification of any potential risks and a system in place for managing those risks. There should also be adequate briefing for all research team members and adequate support provided if needed. So some of the considerations in the study implementation stage include the sample selection. So how are the sites selected, and how are the individual research participants selected? Has there been any consideration of risks to the research participants and the research team members, whether these are physical risks, psychological risks, or psychosocial risks? Are there linkages in place to referral services? This is an important element of beneficence. There needs to be adequate information on FGM, on its legal status, on health complications, on any referral resources to support individuals who are either at risk or who have undergone FGM. We should consider in the selection process of the research team members and data collectors some of their characteristics and how that could influence the responses of participants and the comfort of participants in responding to sensitive questions. So the sex of the data collector, the ethnic and linguistic characteristics of the data collectors and the research participants should be taken into consideration. What are the risks of social desirability bias? And what are the concerns that need to be addressed in terms of confidentiality? So there are two hypothetical scenarios also for the study implementation stage of the research, and one of them relates to the protection of confidentiality in group settings, and this one relates to a scenario where participants are in a focus group discussion, and it is not always possible for the research team to ensure what is revealed by other participants in the focus group discussion. So that needs to be taken into consideration, or adequate warning needs to be given, or ground rules at the beginning of the focus group. There is another scenario about privacy in safe spaces and how that can influence how much information people reveal, and also can affect the validity of the findings of the research. So I invite you to look through these hypothetical scenarios in the document. We've also developed a checklist for the study implementation stage, and this relates to the consideration about research team members that we've already discussed, about different mechanisms for community mobilization and the participant selection process, in the conduct of the interviews and the focus group discussions, some of the considerations there, how to ensure the data security and confidentiality throughout the research process, how to minimize any risks to participants, and how to minimize risks to the research team members as well. Ethical principles also relate in the analysis and dissemination stage. So researchers and those who are funding programs or who may be funding the research have an ethical obligation to help ensure that their findings are properly interpreted and used to advance policy and intervention development. The CIOMS document that I introduced earlier calls for research to be translational, and it recommends that community engagement continues through all stages of the research, including during the dissemination stage. There should be disclosure of the study limitations when presenting the findings, and these relate to the sample size, the lack of generalizability of the findings, any measurement limitations, the lack of controlling for confounding factors or other risk of bias. Should ensure that we avoid stigmatizing different groups or reinforcing negative stereotypes, whether these are specific ethnic groups or religious groups. There is a hypothetical scenario on this. The research should contribute to policymaking and discourse. We should engage policymakers in a dialogue about the findings of the research. The research can contribute to ongoing advocacy and programmatic activities. We should enable stakeholders across different sectors to come together for cross-sectoral dialogue to explore the potential interventions and to increase collaboration. And we have another hypothetical scenario around this concept of research to action. We also have a checklist for the data analysis and dissemination stage, and this relates to both minimizing risks to participants, making sure that the confidentiality and safety of participants is maintained through this stage of the research process as well. In terms of authenticity, have we mentioned all the limitations of the methodology? Have we used quotations accurately? Have we sensitively portrayed the different groups or participants in the research? Is the research locally owned? And how can we disseminate the findings and also ensure capacity building in the dissemination stage and the next subsequent stages as well? Are we presenting the findings of the research in an appropriate format and style to a particular audience? Is the research being disseminated locally to the local stakeholders, nationally and internationally? There may be different formats and ways of presenting the research to different audiences, but it's important that the research does inform policy and programs at different levels. And to summarize, some of the key messages of this document and of this presentation are that high-quality ethical research on FGM is needed to guide efforts at the international level, at the national level, and at the local level in order to find ways to effectively end this practice. How research is conducted affects the rights and welfare of the participants and the quality and the validity of the results, and how that these research findings can be used to inform programs and policies. Researchers themselves and ethics committees who are reviewing the research have an ethical responsibility to maintain the core principles of respect for person, beneficence, and justice at all stages of the research. The sensitive nature of FGM requires that special consideration is taken when applying these principles during the planning and the conduct of the research, as well as the interpretation of the data and the dissemination of the results. And that the concepts of privacy, vulnerability, and confidentiality, as well as voluntariness, must underpin all stages of the research process. You can find the ethical considerations in research on FGM ethical guidance document here at this link, and I invite you to use it and disseminate it amongst your networks. Thank you for your attention.